I'm Dr. Deborah DeMarco, a rheumatologist at UMass, and I had a knee replacement in 2009. I was a marathon runner for a number of years. I've exercised pretty much my whole life. About 2005, I started to notice pain while I was running in my right knee. Of course, I ignored it, being a physician and being a rheumatologist. And then I started taking anti-inflammatories as needed, some Tylenol. But I reached a point where I continued to have pain and finally sought medical attention. I had my first knee arthroscopy at UMass Memorial in Marlborough, and it didn't really make much of a difference. I was still able to run, but it was becoming apparent that I was going to have to give up running at some point. In about 2008, I first saw Dr. Ayers at UMass, and I think he was actually a little surprised when he saw my x-rays because I was kind of young to have such significant OA. I never had a major injury to my knee, but I do have a family history of osteoarthritis in my mother and other family members. I had the surgery in 2009. My experience was really much smoother than I ever expected. I would say I had an excellent post-operative course. Of course, I was spinning up until the day before, and that's one thing I really try to emphasize with my patients and other people that I might be counseling about a joint replacement, is that you really need to get yourself into the best shape you can before the surgery because it really enhances your recovery. When is the right time to have the surgery? And it's really a very personal decision. For me, I went from being able to run a marathon to not being able to walk my dog around the block without having pain. So I was young to have a knee replacement, and I might face having a revision because I was young, but to me, the lifestyle issue was the most important in being able to do the things and the activities that I like to do. I looked into Boston hospitals and area hospitals, but ultimately chose UMass because of the reputation of the surgeons, the nursing care, experience that my patients have had at UMass with good outcomes and good care there. And I didn't really see any reason to have to travel out of my own community to have the surgery. So I rode my first long distance ride about, I would say, a year and a half after my surgery. It was a 150-mile bike ride, and since then this will be my 4th year, as well as doing a number of century rides, which are 100 miles. And again, I can do all of that: spin, swim, walk, all pain-free.